Well, good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Monday, April 20th. Joining us today, Dr. Eileen Davila, Toronto's Medical Officer of Health, Mayor John Tory, and Fire Chief and General Manager of the Office of Emergency Management, Chief Pegg. Starting today, Dr. Davila. Doctor.
Thank you, Brad, and good afternoon, everyone. As of 12:30 this afternoon, there are 3,682 cases of COVID-19 in Toronto. This includes 3,343 confirmed cases and 339 probable ones. There are 262 cases hospitalized, 99 in intensive care units. I'm sad as well to report that we continue to see deaths in our community. In total, 181 people have died of COVID-19 in Toronto. I offer sincere condolences to everyone who has lost loved ones or friends to COVID-19. My team continues to work very hard to provide more timely and detailed COVID-19 data to the public. Data are at the core of the COVID-19 response in Toronto. This information helps us understand what is happening in our city and informs our actions to reduce virus spread and prevent deaths. It also helps us to see whether public health measures like physical distancing are working and when and if we need to change our approach. Last week, I committed to providing you with an update on our local COVID-19 data story. There are 3 parts of this story: the number of people currently infected with the virus, the simultaneous COVID-19 outbreaks in our city, and finally, where our story goes next. The first part of our story is the number of positive COVID-19 infections at any given time. This figure helps us understand and prepare for demands on our healthcare system. It also tells us if public health measures are working and when they might need adjusting. Given the recent provincial changes to testing guidelines, particularly in our long-term care homes, we will see this number go up in the coming weeks as more people are tested. While this may be unsettling, it is not unexpected. More aggressive testing is critical, particularly in long-term care homes, as it will help us to identify infections sooner and support our long-term care homes to implement stringent outbreak control measures faster. The second part of our data story is that there are 2 distinct outbreaks within our city. One in our broader community, and the other in congregate settings, particularly in long-term care. These are distinct because they occur amongst 2 different populations with different risk factors for acquiring infection. We also see COVID-19 infections leading to different outcomes in these 2 settings. Looking at our data, we can see that hospitalizations for COVID-19 have been driven by cases in our broader community. On the other hand, deaths in our community have been driven largely by the COVID-19 outbreaks we are experiencing in our long-term care homes. In addition, the actions we must take to protect people in these 2 settings are also different. In our broader community, the data collected informs physical distancing measures and other public health actions. In long-term care homes and other settings where people are in close proximity to each other, data informs specialized infection prevention and control measures and more outbreak control measures, such as the comprehensive long-term care action plan that was recently released by the province. To ensure that you continue to be informed, my team continues to post new data online about outbreaks in local long-term care homes and retirement homes. This will be updated every Monday, Wednesday, and Friday. The final part of our data story relates to where we go next. This is informed by the use of data models to help us gain a better understanding of where we are on the curve of pandemic activity and where we might be going next. Our data modeling shows us that we are currently in the peak period for our reported cases. The COVID-19 case doubling rate, which captures the number of days for our case counts to double, has slowed over the past 2 weeks. This tells us that pandemic activity is slowing down, and this is good news. The province has increased testing capacity and will be testing more people, especially in long-term care settings. So we can expect to see more positive COVID-19 cases. While this is important for our understanding of how the virus is spreading, and it is also important in supporting better implementation of virus control measures, with this change in testing, it is difficult to project how many more cases we will be seeing. Another data point we continue to monitor to understand where we are on the COVID-19 curve is hospitalizations. There is good news here too. We haven't seen the dramatic surges in hospitalizations that we originally feared, and in fact, the number of new hospitalizations each day has started to decrease. All of this information, taken together, should be considered with cautious optimism. We are seeing our curve flattening because you are washing your hands. You are staying home, and you are keeping a safe distance from your friends, your families, and other loved ones, as difficult as I know this is. I do need to stress that the only way we will continue to be successful is if we continue to keep these measures in place for more time, and for everyone to continue to do their part by staying at home. Another update I've been asked to provide is on the situation occurring at the Willowdale Welcome Center. As of this morning, there were approximately 74 positive cases of COVID-19 in this setting. In closing, I applaud the province for the stronger measures they have implemented to support vulnerable residents in congregate settings, such as long-term care homes. We need to further strengthen these measures in long-term care homes, and I encourage the province to ensure that appropriate policies and resources are in place for these settings. This action will support optimal infection prevention and outbreak measures to ensure that these residents are getting the best care possible. Another congregate setting we need to consider is our shelters and respite centers. Earlier this year, our city recognized housing as a human right and as a key determinant of health. Everyone in our community deserves appropriate housing. In response to the COVID-19 emergency and through the collaborative efforts of many partners and community agencies, we have been able to transition many people out of congregate settings and establish them in more sustainable housing. This is a remarkable achievement. We must continue to build on this momentum to best protect the health of people in our city experiencing homelessness. This is not just for COVID-19, but it is also for the many other negative health impacts associated with homelessness and underhousing. All health, government, and community partners must continue to be united as we all have a valuable role in fighting virus spread. Working together is the only way forward. We continue to learn new information about this virus each and every day. We need to be open. We need to stay open to working outside of our comfort zones. We must be nimble and armed with empathy to respond and adjust our actions as new facts are confirmed. When we are divided, the virus gets through the cracks between us. Please remember that the most important thing you can do right now is to continue to stay home, stay safe, and take care of each other. Thank you. I'll now turn it over to Mayor Tory.
Thank you, Dr. Davila, and good afternoon. May I begin today by expressing my condolences on behalf of the people of the City of Toronto. I know all of the people of the City of Toronto, to the people of Nova Scotia following the tragic violence of this weekend. We join you in Nova Scotia in mourning the loss of RCMP Constable Heidi Stevenson and all of the other innocent lives that were taken. This is clearly an act of evil, and I hope that in the coming days there will be some answers as to what happened and why, to help the families and the friends of the victims as they grieve. The Toronto sign has been dimmed, and flags at City Hall, Metro Hall, and the civic centres have been lowered in remembrance of all those who were killed and to support our fellow Canadians in Nova Scotia. When something unimaginable like this happens in any part of Canada, it deeply affects all of us, and I want Nova Scotians to know that Torontonians, all Torontonians, have them in their hearts. I want to thank Dr. Davila for today's update and share in her cautious optimism. Cautious optimism. All of the efforts that people have undertaken, based on her advice and the advice of all public health professionals, these efforts are helping to flatten the curve, but the job is not yet done, as you've heard from her today. I want to thank every resident who is doing their part to fight the virus, just as we all continue to thank our healthcare workers and people working shelters and other people who are doing these essential jobs for us as part of the fight against this virus and its devastating effects on those who become infected and on their family members and others. The message is clear. We've come a long way. I know it hasn't been easy for anybody in Toronto, but we're now in a better position to win this war. We will win as long as we stay the course. And we're on the right course now to stop the spread of COVID-19. And we will be ready, when we have won, to put forward and to move forward with a careful plan to restart the city and launch Toronto's economic recovery. As part of our ongoing response to COVID-19 as a city, we've been working to redeploy city staff to areas where they are needed most, including places like our long-term care homes and our shelters. Close to 500 staff have already been redeployed into roles in our long-term care homes, our shelters, and helping, for example, to answer the phone and to answer emails at the 311 call center. Over the weekend, we were able to reach an agreement with Local 79, one of our unions, the members of which serve us so well, as a guide to redeployment. And today, we reached a similar agreement just today with Local 416, one of the other unions that represent so many of the people that serve you and serve us here at City Hall. These emergency framework agreements establish some guidelines on the reassignment of staff and for Local 79 members in particular, in the event that they can't be redeployed, provide for temporary leave procedures that protect employees' positions and certain employment benefits. This agreement is fair to Toronto residents and it is fair to the members of our city staff. It also ensures that we can quickly move to put employees where they're needed right now to help in our response to COVID-19. I've said many times that this is an all-hands-on-deck effort to stop the spread of this virus and to save lives. This agreement will make sure that it is all hands on deck in key city services as we move through these next critical weeks. It makes sure that we continue to deliver all of the critical and essential services that Torontonians rely on during this pandemic. Both unionized and non-union staff not assigned to essential or critical work and who have roles that cannot be done remotely will be the first wave to receive a redeployment survey. There'll be about 1,900 of those people. This survey will give staff an option to opt in to redeployment or to opt out of redeployment. Those who opt in will be reassigned according to the needs and demands of our COVID-19 response efforts. Those who opt out will be assumed to be requesting placement on emergency leave. Emergency leave will provide those staff members with access to employment insurance or the Canada Emergency Response Benefit, as well as the same health and dental benefits in which they're currently enrolled, including OMERS, if applicable, and continued accumulation of their seniority. However, they will not report to work and they will not be paid their regular pay. Every effort will be made to accommodate staff who opt in to redeployment but have specific needs. For those who cannot be redeployed but who have agreed to be redeployed, they too will be placed on leave, but they will get a wage top-up beyond the employment insurance or emergency benefit amounts to which they would be entitled. I'm extremely proud of how our workforce is stepping up during these extenuating circumstances, now more than ever, and I want to thank them for helping their city when it is needed the most. I'm also extremely proud of how the vast majority of our citizens are stepping up to do everything necessary to defeat this virus. Let's remain positive. Let's combine continued self-discipline with hope, and if we do, the nightmare will come to an end much sooner. I'd now like to invite Chief Pegg to deliver an update from the Emergency Operations Centre. Chief?
Thank you, Mayor Tory, and good afternoon. Our Emergency Operations Centre continues to operate 7 days per week, ensuring that both critical and essential services are being provided without interruption. I extend my sincere thanks for their tireless work each day. At present, our personal protective equipment levels remain stable, and our team continues to work hard to source the equipment that we need on a go-forward basis. I expect to provide additional PPE updates later this week. I'm also pleased to report that the supervised injection site at 277 Victoria Street, also known as The Works, reopened on Saturday. Our team in the Emergency Operations Centre worked very closely with Toronto Public Health and other city partners to ensure that this facility was able to reopen and is able to operate in a safe and effective manner. The current construction on Victoria Street and the installation of the construction fencing in the area required the development of a comprehensive operational plan that took into account the health and safety of both our clients and our staff at the site. Clients can now attend the Works supervised injection site between the hours of 1:30 p.m. and 8 p.m. from Monday to Saturday, and between 11 a.m. and 5 p.m. on Sunday. These services are accessible by appointment only and will be provided from within 2 private booths in 30-minute appointment increments. Prioritizing the continued operation of this site is part of the city's continuing efforts to ensure that our most vulnerable residents are being cared for during the COVID-19 pandemic. The Emergency Operations Centre is finalizing a number of proactive contingency plans for high water levels in Lake Ontario, and I will provide additional updates on these plans later this week. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. I am proud of every member of our City of Toronto team who continues to work hard in support of our residents each day. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. We'll now go to questions. First up is Matt Bingley from Global News. Go ahead, Matt.
Hi there. Just have a question about the TTC. Another 2 staff members have tested positive for COVID-19. That brings the number up to about 23. I'm just wondering if you're satisfied. I'm not really sure. I guess the mayor and the chief medical officer. My question is really: are you satisfied with the way that safety is being handled on the TTC, and where would you like to actually see it improved?
So I'll start off with that. Thanks, Matt. I think the fact that you're actually seeing cases picked up shows that there is a system in place for testing, which is a good thing. I know that people are often concerned when we see positive cases, come to light. But in fact, identification of cases is the first step towards controlling disease spread within our city. So I think that this is a positive step, and I know that our colleagues at the Toronto Transit Commission are working hard to ensure that they're providing the best occupational health and safety environment for their workers. And I know that worker and rider safety are a paramount concern to management at Toronto Transit Commission. I think, if I have anything further to say with respect to this issue, it's that we also know that there is spread in our community. So I think it's important to recognize that just because cases are happening amongst TTC workers, that's not necessarily a statement on transit itself. It is a statement around what is happening within our community, and we know that we do have community spread. So that really emphasizes the point for me and the message that we have been saying. In order to allow for the health and safety of essential workers, including those who provide service at the TTC, I continue to ask people to stay home as much as possible, because this is how we can, one, ensure that we protect the health of all residents in our city, but particularly to protect the health of those who are providing essential services, like those who are working at the TTC.
Mayor Tory,
Yes.
I'm just wondering, you've talked a lot about the plans that are under works to actually reopen the city. I know it's still premature at this point, but when it comes to the TTC, is that something where you envision that we could have just like a capacity issue on the TTC as we begin to sort of open back up and get people into the open again?
The main theme that has come out of our discussions that we've got well underway with respect to planning for the reopening of the city is the main theme is to have a marriage between the public health imperatives of keeping people healthy, preventing a second wave to the maximum extent possible, and the task at the same time of reopening the city. So obviously, one of the complexities is one that I worry about a lot, and that we've mentioned a lot just in our early discussions, is how you make sure that at the time you're going to have more people once again riding the transit, that you make sure that it is done in such a way as to not in any way create a new health problem. So that is part of the marriage between public health and plans to reopen the city, which we're not there yet, but that's why we're going to have the time to make these plans, and that's going to be an all-important consideration, which we will rely on, as we have throughout this whole pandemic, the advice of our public health people as to how we can try and accomplish both objectives, to have transit available for people to use to get to where they're going, but at the same time to make sure that we keep people healthy and don't contribute to any backsliding on the fight against this virus.
Okay, we'll go now to Derek DeHonorin from the CBC. Go ahead, Derek.
Thanks, Brad. This question is for Dr. Davila. So on Friday, there were 10 confirmed cases of COVID-19 and no deaths at the Manor, Isabel and Arthur Manor. Today, there are 50 cases with 14 staff members infected and 18 deaths. How do these numbers spike so fast?
So I think that there are a number of factors, probably the most important of which is the fact that there is testing that is happening, and I think that this is an important step. We've talked about the long-term care action plan that's been released recently by the province, and increased testing also promulgated by the province, which, yes, results in an increase in case counts, and that is unsettling and jarring for many of us. But as I've tried to emphasize, this is it's a good thing to actually have more testing. We can identify infections faster and implement those strict outbreak control measures that are needed in order to bring those situations to control. I think the other thing, though, that's important is that when it comes to long-term care settings, as we've spoken about many times at this table, long-term care homes and the residents tend to be older in age, and have existing chronic health conditions and or conditions that suppress their immune systems. So unfortunately, they are vulnerable to infectious diseases when they enter the home. We see this every year with influenza, and we're certainly seeing this with COVID-19. So when there are cases amongst residents of long-term care homes, the unfortunate matter is that we will see some deaths there, as we have in other long-term care settings throughout the city, and in fact throughout the province, the country, and internationally as well.
Okay, and to follow up here, what's being done by TPH in terms of holding these homes accountable and being transparent about what's happening inside, or is this something that's up to the homes themselves?
So when it comes to long-term care homes and their regulation, they are under the purview of the provincial government. There is a Ministry of Long-Term Care, and they are the agency of government that is most responsible for the regulation of long-term care. As far as Toronto Public Health is concerned, our role in respect of supporting long-term care has to do with supporting them in terms of infection prevention and control measures, and providing support when it comes to outbreaks. So there is an obligation on the part of long-term care home management teams to inform Toronto Public Health as to whether they suspect they have an outbreak, or if they know they have a confirmed outbreak. They are meant to inform us. That's their obligation under the law, and we provide support to try to bring those outbreak situations into control as quickly as possible. However, over the last several weeks of COVID-19, we've had a team in particular at Toronto Public Health that has focused on COVID-19 within long-term care settings. We've been actively working with healthcare partners, hospitals, and the provincial government as well, to try to make sure that these long-term care homes have access to the many resources that have been put forth, some by us, some by the provincial government, so that they're best able to provide, good conditions and the best care to their residents.
Okay, thank you. We'll go to Brian Passafume from the Toronto Sun. Brian?
Yeah, good afternoon, everybody. My question's for the mayor. After a month of Dr. Davila and Chief Pegg telling us to stay home except for emergencies, recent concerns raised by civil rights groups about social distancing enforcement, and just a day after announcing online options to report social distancing violators, there's been a few concerns over last night's Salute to Hospitals event in the downtown core. Obviously, nobody's questioning the need to pay a well-deserved tribute to our vital healthcare and frontline emergency workers. But can you explain the decision behind organizing and participating in what ultimately turned out to be a huge gathering of people in one small area?
Well, first of all, I think that about 2,999,000 Torontonians would have wished that they could be there to pay tribute to the healthcare workers that are doing so much for us. They're inside those buildings day after day, saving our grandmothers and grandfathers and parents and brothers and sisters. And I think if people could have seen the tears of joy on their faces and the incredible expressions of gratitude for the fact that a few of us showed up, and it was a relatively few number of people who showed up, and some of those healthcare workers were able to take the time from their jobs to come out into the street. And so I think it was something that I know in my own case I would accept Chief Saunders' invitation to participate in this only 100 times out of the next 100 times that it was offered. But I don't think it's something that's going to happen often. I think it was really important for us to do on behalf of all the people that we represent. And I think it was done in a way that was respectful of the advice that we've received from Dr. Davila and others. With respect to the concerns about the distancing bylaw that was put into place, I would only say that obviously legal advice was sought before that bylaw was proclaimed, that I'm glad we live in a system where people can dissent from that and can take legal recourse if they wish to do so. But I think in the circumstances, that bylaw too was put into place based on professional health advice that said, as you've heard again today, that community spread is one of the main reasons why the number of people continue to get infected that do, and that something like this that simply reminded people of what they'd been told many times and applied to public spaces was going to be necessary if we were going to save lives and stop the spread of this virus. And so To me, again, I think that was the right decision to take. I stand by it, and there's always people who have a differing view on that, and I'm happy about that, and I'm happy for civil rights advocates, but I think this was the right thing to do to help spread the virus, and I'm relying on our law enforcement people to carry out the enforcement of the law as they, I think, try to do all the time in a sensitive way that starts first with education and persuasion and only comes to something else at a later time if necessary.
No follow-up, thank you.
Okay, Brian, thank you. We'll go now to Lauren Pelly from CBC News. Go ahead, Lauren.
Hey all. So we've heard from people in various high-rise buildings in Toronto that broken elevators are causing greater concern now in the pandemic because they don't have a few people in an elevator at a given time, leaving people to walk floor after floor or feel like they're supposed to cram into one elevator when it shows up. Is there anything more that the city can do to step in to encourage these buildings to get these elevators fixed a little bit faster?
One thing we can do, and we have done in a number of these kinds of instances, is to speak to the people in the industry and see what we can do. There's only so many elevator repair people to go around. This was something that long before this pandemic started, I think there were not necessarily enough to take account of all the high-rise development that's taken place in the city, but I certainly understand this is a real challenge, especially for people who are a bit older, or where we're very clearly, and certainly the building I live in, it's very clear that it says 3 people on an elevator in distinct corners of the elevator, and that's obviously much less possible to do in the event that there's fewer elevators available than are supposed to be working. So I will see if I can't reach out to the companies that are involved in this and see if there's anything we can do to help them, but I suspect it's a supply and demand problem, and we'll see if there's anything we can do to move that forward. I think it's a valid concern.
That's all.
Okay, Lauren, thank you. Go now to Mark McAllister from City News. Mark, go ahead.
I'm not sure if Marianne Bedard is in the room. If so, I have a question for her.
Marianne is on the
If not, I
line.
can
Go ahead,
take
Mark.
one of the other. Okay. Marianne, if you would, when we're talking about relocation of some of our city's homeless into all of the different locations that you've managed to secure, some of which are Toronto community housing units, just curious what type of testing may be done before these people are moving into these spaces. We've got some concerns from the residents in the buildings as these units are being prepared about the people that are going to be moving into those spaces.
Oh, hi, it's Marianne. Yes, I can understand those concerns, and I can assure them that we will not be utilizing TCHC units for anybody that has tested positive for COVID-19. As we've been taking measures to prepare and respond to this response, one of the key pieces that we always wanted to keep in mind was the opportunity to make sure that people could be housed. So with that in mind, we've been working with TCHC on our rapid rehousing initiative and exploring opportunities to permanently or temporarily house people in TCHC units. And that is the case with the units that you're referring to in Regent Park. They have been recently vacated for future revitalization, but that does mean that for a short period of time, they might be available to us to be able to create that all-important social distancing for people in shelters that just need a little bit more time to find more permanent housing. So, obviously, I want to reassure those tenants, and we will be proactively engaging with tenants to make sure they understand when and if we activate units like that, what the purpose is, who the people will be coming in to stay in those units. We are making sure we make good housing connections. We're using our coordinated access process, which assesses eligible clients, and making sure that we're able to match the appropriate level of support for successful tenancies.
That's all. Thank you.
Do you have a follow-up, Mark?
No, that's all. Thank you.
Okay, thanks, Mark. Go now to Jennifer Pagliaro from the Toronto Star. Jen?
Hi there. I had a question for Dr. Davila. We heard from the province's update earlier that there is some data by postal code to show that those living in low-income neighborhoods are at highest risk. And I wonder if you've seen that data and if that applies to Toronto in your assessment.
So thanks for the question, Jennifer. We certainly do look at data and we map data frequently when it comes to infectious disease outbreaks. This is often an important component of our work in terms of understanding the spread of disease in a community and who is impacted by that disease. It's interesting, though, with this particular virus, there are, I can appreciate why there would be interest in looking at it this way, and I've had some early conversations with some academic partners about how best to provide data to the residents of the city in a way that's meaningful and appropriate, and also provides people with the right context and a meaningful context in which to understand those data. So when it comes to respiratory diseases, it's actually difficult to know whether, in fact, having a sense as to the home address of those individuals who are impacted gives you a sense as to risk that's appropriate. We know that we have community spread and that people do move. We have a very mobile population. So understanding where people live may or may not give you an appropriate understanding of risk in our community. And I think we have to be very mindful of that. I think the other thing is that when we look at this particular outbreak, you might recall that initially at the outset, travel was a more significant risk factor. And so the data told us a very different story. And over time, as we started to see community spread and knowing how generally mobile our population is, the story did start to change. So I think there are a number of different considerations. We're just working through how best to put out meaningful data with appropriate context so as not to stigmatize particular neighborhoods inadvertently or stigmatize particular areas of the city in a manner that frankly isn't helpful to us as public health or to the residents of this city writ large.
And can I just follow up with you on a different topic? You mentioned the increase in testing capacity and targeting long-term care homes to help with the situation there. Is the city looking to also have increased testing or having any broad kind of testing in the shelter system, knowing we're experiencing outbreaks there?
So just to be clear, testing is within the provincial purview. They're the ones that actually have the labs, and they're the ones that are best able to, increase capacity, because that's actually something that they're responsible for. There is the Public Health Ontario laboratory system, and as well there are labs associated with hospitals, which of course are funded through the Ministry of Health. When it comes to our role in Toronto Public Health, clearly our role is around supporting efforts to improve public health in the city. And as I've mentioned through my remarks, both today and at other times, ensuring that we're taking care of the health of those who live in our shelter and respite system is an important concern for us at Toronto Public Health. So I can tell you that we are actively partnering with those who actually have purview over testing, hospitals and their assessment centers and the shelters, in order to facilitate more testing in these settings, similar to that which is happening within the context of long-term care for exactly the same reasons. The more testing that you're able to do, the earlier you are able to identify infections and the sooner you're able to implement appropriate controls to minimize virus spread. So, the short answer is yes. But because testing is not entirely within our purview, actually it's not within our purview at all, we have some influence that we can bring to bear, which we're doing, but it is something that we rely on other partners to collaborate with.
Okay, thank you. We'll go to Siobhan Morris now from News Talk 1010. Go ahead, Siobhan.
Thank you. My first question is for Dr. Davila. You've talked about us being on two tracks with COVID-19, one in terms of community spread and the other in congregate settings. And I'm wondering how that might affect our reopening efforts, so to speak. Do you need to see significant improvement inside a long-term care home and shelter before loosening restrictions to the broader community?
I think you ask an excellent question, and one that we're actually turning over ourselves. New virus, as I've said many times in the past, one that was just discovered in January, And here we are, a few months later, still very much learning each and every day around this virus. We're looking at what other jurisdictions are doing, how they are managing their circumstances, particularly those that are a little bit ahead of us in terms of their own outbreak experiences and outbreak curves. So I don't know that we have all the answers yet, but certainly what we know is that we need to take into consideration how we achieve this balance between public health measures and how we successfully, restart and reopen the city, as the mayor has already indicated in one of his earlier answers to a question. We know that we're going to need to see, pretty good disease control within the city. We're going to need to ensure that we've got capacity within the healthcare system to manage any potential increases while in COVID-19, while at the same time ensuring that they have capacity to manage other medical conditions as they arise. And of course, we're going to be looking at social and economic indicators because these are also relevant to health. So delicate balance that needs to be struck. Answers still very much in development. But as you can appreciate, we will be having to follow these two different outbreaks in the city. These two different stories need to be considered as we make those very important decisions on a go-forward basis.
Have a follow-up, Sean?
My follow-up, yeah, this could be either for Dr. Davila or for Mayor Tory. I'm not sure what to call them, but we saw over the weekend in the States a number of these anti-shutdown or anti-isolation rallies. I'm wondering what your impression is of these things. If you have any fear about these popping up in Toronto, especially as people may be hearing that we're reaching or have reached rather the peak of the pandemic and think that, okay, let's get things moving now.
Well, I think most people out there understand that reaching the peak doesn't mean it's time to sort of open everything back up. I think people here also understand and experience themselves feelings of frustration at the fact that they can't go to work or their kids can't go to school or they just can't leave home. But I think people here are also smart enough and are considerate enough that they understand that what has been done so far is working. One of the reasons that we actually, may be at the peak and that the curve is starting to flatten, as Dr. Davila said, is because people are staying home, because they are not going out in groups to the park, because they are, doing what they've been asked to do in terms of hygiene and so on. And so I just don't think it's something that's going to come to Canada. I don't think there's anybody here that is politically advancing the notion that this is a helpful thing to do. I think people are just gritting their teeth, as it were, and are maybe having a little bit of a sense of hope that what we're doing is working, but that there's a long way to go and that that's what we should focus our attention on, as opposed to having movements to reopen what could be too early and thus end up back in the same sort of situation we're in today for a lot longer through other parts of this year or other years. I think people know that's the worst nightmare of all.
Okay, thank you. We'll now go to Francine Copen from the Toronto Star. Francine?
Oh, hi. My question is for Marianne Bedard. I wondered if you could tell us what specific actions are being taken to control the outbreak at Willowdale.
Hello, Francis. Yes, so we're working very closely with Toronto Public Health at that site. They'll be doing the contact tracing. We are also working with North York General, who provided the mass testing over the last few days, and they'll be helping us assess the health status of clients there. We are making sure that we're triaging clients and sending them to appropriate programs based on their health status. We're working with Homes First, who is the provider on site, making sure that there are proper enhanced infection prevention and control measures as per the TPH guidelines, and that any clients that are remaining on site continue to respect the physical distancing that is required.
And a follow-up question, have all the clients been tested, and are all the tests back?
We do not have all the tests back yet. My understanding is that that they've tested almost all of the people on site. We received some test results back last night. I think we're receiving some more today. And each little bit of information gives us a lot more information to go on. I think as Dr. Davila has talked about at this site, and I think as we're learning more about the virus, quite a few of the people were actually without symptoms. And so this is why it is so critical for us to work with the province on this proactive testing measures in shelter, because it's really important for us to know where the virus is and to help us respond appropriately and quickly to it.
Okay, thank you. Last question now to Scott Lightfoot from CTV News. Scott?
Thanks, Brad. It's an honor to be last. Question for Dr. Davila. I think everybody's been waiting for signs of positive news, but are you at all concerned that as people hear you say the curve is flattening, as the province adjusts their modeling to say that the pandemic may not be panning out to be as severe as first predicted in Ontario, that people will interpret those as signs, not necessarily that society can go back to normal, but that they can start sort of lowering their guard or returning to old behaviors individually?
So, Scott, I think that's an excellent question, but you'll recall in my remarks that at the end, I concluded with the most important thing that people can do is to continue to stay home, stay safe, and take care of each other. I think what we're trying to do is imbue a sense of hope and to tell the people of Toronto that the measures have been working, but it is not yet time to take our foot off the gas. We need to continue to do that which we've been doing, as difficult as it is, if we are to get to the other side of this, wave of the pandemic in as timely a fashion as is possible.
And slight follow-up for the mayor. I mean, obviously it was difficult to convince people to make all these changes to daily lives, but seeing what was happening around the world and the predictions of what could happen here probably helped people make those decisions. Do you think that over the next few weeks or maybe a month or two, it's going to become more difficult to convince people to stay the course? You mentioned fatigue was setting in last week, the weather's getting nicer, and now you're starting to hear these positive messages about how the curve is flattening.
I think it will be a challenge because, the longer you go on confining people and restricting them from engaging in their normal daily lives, there's a level of frustration that arises. The weather becomes a contributing factor, but I think just the passage of time makes it more difficult. But I think that the reason we're quite repetitive in the message that we put out about how these restrictions are working, and they're working not to eliminate the problem, but to flatten the curve. And what that means by definition is we've flattened the curve, but now we have to turn that curve down and get to the stage that Dr. Davila technically explained better than I could, where we are basically wiping this out in this wave and see what happens then in the future. And we will then have plans ready to make sure people can resume their normal lives. But the worst thing we could do is to not follow the advice of our public health professionals and to reopen things too soon or reopen them too much or too fast when we start. And so we're abiding by that professional advice as we have throughout. That's why we've had some success to date, thanks to people's cooperation. That's why we need their cooperation going forward so that we can continue to have success and get back as soon as possible to the lives that people want to see return to them. So we're working on that very hard, but it's a team effort, and we need people to continue to cooperate as they have been doing.
All right, thank you very much, everyone. This concludes today's briefing. We'll see you again tomorrow at 3:45.